Good morning, student. Today's is a very short lecture, Introduction to Biomedical Ethics. Right. In this short introduction lecture, right, there are two learning objectives. We hope that at the end of this lecture, you will know, number one, what is biomedical ethics, and also number two, a bit about the history, development, and importance of biomedical ethics in the society now. Now, what is biomedical ethics? This is actually a course on the study of ethical issues arising from biological and medical sciences. So what it means is, in the biomedical arena, which is like in medicine, in healthcare, there are a lot of ethical issues, right? Ethical issues like, for example, can you allow kidney transplant on some patients? Are you allowed trading of organs? Are you allowed to do experiment on unproven drugs on other people? So these are some of the ethical issues that we need to explore, in our current healthcare setting, and thus this is what it means by biomedical ethics. There are a variety of bioethics or biomedical ethics, and this could be in the form of medical ethics. Right? Medical is a more subgroup of the biological sector that deals mainly in the medical aspect of it. This can be like in the clinics or in the hospitals where it features around the doctors, which is called physician-centered. Example of some of these medical ethics could be like, if there is lack of resources to treat a patient, does the doctor treat this patient over the other patient because this patient is richer, or this patient needs the healthcare more than the other person? So these are some of the ethical issues that center around the medical ethics. Healthcare ethics is actually a larger group, right? That includes, the hospitals, that includes nurses and other healthcare professionals. It also includes, for example, utilizing resources in a healthcare institution. One example could be like, if you are short of a hospital bed or intensive care unit bed, if you only have one bed and you have two patients who are very sick, how do you allocate the bed? Do you allocate the bed to the person who can afford it? Do you allocate the bed to, say, the person who is more sick, or do you allocate the bed to the person who actually has a chance to recover? If the other guy doesn't have a chance to recover, then you might as well don't give the bed to him. So these are very ethical issues, because there's, when you have faced with this situation, you need to know how do you make the right ethical decision. Clinical ethics are very similar to medical ethics, where it centers around the treatment of the disease itself, right? So for example, it could be in terms of new research on a new drug. If you have a new drug, and a patient is very sick and the existing drug doesn't work on him, is it ethically right to give him this new experimental drug? If you give it to him, he may recover, but on the other hand, because it's experimental, he may die from that. So these are some of the issues that you need to look about clinical ethics. And of course, the large bioethics group in general. So this is a larger umbrella that covers a lot of other issues like genetics, organ tradings, and also reproductive technologies. For example, artificial insemination, is it right or not? Or can you select a sex of the baby, and so on. So these are some of the ethical issues that covers in the bioethics arena. Now, when does all this bioethics started? It actually started way around Second World War, where the Germans were actually using human beings to do experiment. The Nazis were using human beings, and they want to see whether, which kind of weapons that can kill people faster and so on. So that is certainly unethical. But after the Second World War, there was a lull period, and then it became more of an emergence that somewhere in the 1960s, people are more concerned that, we should have regulation about bioethics, because people are more affluent after the World War, the countries are rebuilding, and there are a lot of healthcare issues that arise it. For example, in US in 1962, one of the problems, the ethical problems that they face is actually selecting patients for dialysis. Dialysis machines are very rare, not that many. Even in Singapore today, there are not many dialysis machines. So if there are a lot of people who have kidney failure, how do you allocate the machine to the different patient? Is it first come first serve? Who has illness first, so he gets a machine? Those who have illness later on, too bad you don't have a machine. Or is it because by affordability, who has more money can pay for it, then he gets a machine? Or is it because by race itself, in US somewhere maybe the whites are more superior than the blacks, so the whites get a machine instead of black? So these are some of the issues that arose out of that. And because of that, the medical community feels that there is a need to have a relook at how do we apply ethics in this sort of situation, right? Now, of course, why bioethics is important now? Well, there are a lot of reasons why it's getting more and more important. Number one, patients nowadays are more educated with internet, with newspaper and so on. They are more informed of the treatment option. So it is very important now, before the doctors institute a treatment, they must discuss with the patient the pros and cons of the treatment, especially if it's an experimental drug, especially if it's a very expensive drugs and so on, because they must have a joint decision in that. New technologies, for example, like I say, experimental drugs, gene therapy, where you can choose the sex of the patient, you can change the genetic component of the offspring so that they can be healthy and so on. So these are new technology that comes in, and we must have a proper ethical guidelines to know what can be done and what should not be done. And also changing economics of medicine. Previously, it used to be patient pays the doctor, but now there's an insurance company involved. There's companies payment involved. So there are different parties who are involved in the healthcare payment. So how do you pay the person? If the insurance company refuse to pay for this particular treatment, can the doctor give the treatment to the patient? And so on. So these are some of the some of the reasons why ethics are getting very important now. So then, of course, now that we know that ethics are important in our setting, the next question is, who should be the one who is involved in bioethics? Certainly doctors, because they are the one who is instituting the treatments, all right? But at the same time, because doctors are no expert in the law and moral, so you need legal people and lawyers to guide them. And of course, sometimes you need philosophers, people who understand the morals issues, all right? Because they can actually tell the doctors and the lawyers what is the right thing to do and what's the wrong thing to do, right? So how do the bioethics and the healthcare professional works, right? The philosophers can help the professional identify the goals of medicine and develop practical principles, And the moral philosophy will impact on a clinical practice, right? For example, you have a resources limitation, right? You only have one dialysis machine, but you got two patients waiting there. You can only treat one of them. How do you decide? The philosopher look at, okay, can you decide based on first come first serve? Okay, yes, that may be a way, but it may be unfair that the person come later, he cannot get treated. Can it be because you allocate based on how much you can afford? That can be a way, because people who can afford should get the better treatment. But is it fair? Because to deny the poorer people from getting the same kind of treatment. So the philosophers must think through, works with the healthcare professional and know what are the right and wrong way to do that. Right? So at the end, this is the end of the first chapter, right? The lecture. We hope that you do understand a bit of introduction of what is biomedical ethics is, and we hope that in the later chapter you will know more about that. Thank you.